Hi everyone, my name is Mia Harris. I did my case presentation on hypothyroidism. Hypothyroidism is the most common thyroid disorder in which the thyroid gland does not produce enough thyroid hormones, which can lead to various complications such as fatigue, weight gain, cold intolerance, constipation, etc. The thyroid gland produces two hormones, the T3 and the T4, which regulates the body's metabolism. Many factors can cause hypothyroidism, but 95% of hypothyroidism is caused by issues with the thyroid gland itself, and this is known as primary hypothyroidism. Some medications such as lithium, nitroprusside, interleukin, amiodarone, or interferon alpha therapy can also cause hypothyroidism. So for the case study, I have Mary Jane. It's a 45-year-old female, an office worker. She lives alone. Her job requires that she sit for long hours, and she is moderately active outside of work. She's a non-smoker. She drinks on occasion. Mary J presents to the clinic with complaints of fatigue, unexplained weight gain, feeling cold and tired all the time. She reports that her symptoms have been gradual and has become progressively worse over the last few months. She denies fever, neck pain, palpitation, heat intolerance. Mary has no past medical history, and she's not taking any medications, but there is a family history of maternal Hashimoto's thyroiditis. What symptoms do they have? So like I said, Mary had fatigue, weight gain, excessive cold intolerance. She's also complained of feeling depressed, constipation, muscle aches and cramps, tingling and numbness in the hands, poor memory, and difficulty concentrating. Physical exam findings, she was found to have dry skin, thin brittle hair, enlarged and palpable thyroid gland. This is known as goiter. She also had decreased heart rate of 58. There was some hoarseness in her voice. Some swelling of the face and puffiness around the eyes were noted as well. She also had carpal tunnel syndrome, which is the nerve compression that causes tingling and numbness in the hand. Diagnostic testings, she had increased level of the thyroid stimulating hormones, the TSH, level of 6.5. For this lab, the normal is 0.4 to 4.0. She had decreased thyroxine level, the T4 level was 3, and for this lab, the normal is from 5 to 12. She had decreased T3 thyroid hormone level of 50, and for this lab, the normal is 80 to 220. She also had the thyroid antibody test was done, and she had a thyroid antibody in her blood. So this is the anti-thyroid peroxidase and the anti-thyroid globulin antibodies were noted in her lab work. She also had increased cholesterol, particularly the LDL of 200, and for this lab the normal is less than 100. Based on all of this, we can say that based on all of the clinical presentation, the lab result and exam, we can say that Mary Jane is diagnosed with primary hypothyroidism that is most likely due to Hashimoto's thyroiditis. Primary hypothyroidism, as we already know, is when the thyroid gland does not produce sufficient thyroid hormones due to problems with the thyroid gland. Primary hypothyroidism is usually caused by Hashimoto's thyroiditis, which is an autoimmune disorder in which the immune system no longer recognizes the thyroid gland as part of the body's organ, so it produces antibodies that attacks the thyroid glands. When this happens, the thyroid becomes inflamed and swollen and unable to produce thyroid hormones. And as we noted, Mary had goiter, which is a swollen thyroid gland. She also had decreased thyroid hormones, and she also had the thyroid antibodies in her bloodstream. So when the thyroid is not producing enough thyroid hormones, the T3 and T4, The pituitary gland produces excessive TSH, the thyroid stimulating hormones, which is supposed to stimulate the thyroid gland to produce thyroid hormones. But if the thyroid gland is not responding or working properly, there will be an increased level of TSH in the blood. And as we saw with Mary, she had a high level of the TSH in her lab work. Also, when the thyroid hormones become low, the LDL receptors on the liver surface are decreased, and the ability of the liver to clear out cholesterol from the body is reduced, and this will lead to high cholesterol level, particularly the LDL. Furthermore, Mary presented with all the symptoms of hypothyroidism. We know that the thyroid hormone stimulates metabolism and produces energy for the body. So a person with hypothyroidism will have all the symptoms of a slow metabolic process, which includes fatigue, weight gain, sluggish or depressed feelings, and cold intolerance, slow heart rate and respiration, constipation, poor memory, and difficulty concentrating, dry skin, and thin brittle hair. So these are all symptoms of a low metabolism. So treatment for this can be treated with thyroid hormone replacement therapy in the form of medication called Synthroid or levothyroxine. This is giving us a pill taken once a day on an empty stomach, because certain foods containing fiber, calcium, or aluminum containing antacid or iron tablets can interfere with absorption. So it's best to take on an empty stomach in the morning before breakfast or anything else. So this is the end of my presentation, and these are my references, and please print out the note and read along for clear understanding. Okay, thank you.